Okay, doctor, let's first start about just, the pandemic. Let's be honest, millions of people have been grieving the loss of someone, uh, unfortunately, throughout this pandemic. And they've been mourning through Zoom, FaceTime, in a way that we never thought would ever happen. And let's be honest, it's not the same as being together. So let's go to that first question that we have from someone who has suffered through all this. And it's from Denise. And this is what she writes. I recently lost a close friend who had been very sick. I cry, feel guilty, cry again, and get angry that the pandemic kept us apart. Is this part of the grieving process? And if so, when does it end? I'm so sorry for your loss, Denise. And she is just one of so many others, doctor, that have endured this terrible pain.
So thank you for your question, Denise. And again, I'm also sorry to hear your loss, suffered by so many during the pandemic. And you asked a question about grief. And maybe the heart of the question is, what's normal grief? And when should you see a healthcare professional about the grief that you're experiencing? And we know that people grieve over many different trajectories. People grieve and they're really in that depth of grief for a few weeks. And others, they're really stuck in that period of grief and distress and mourning for many, many months, even years. And I would say, not knowing you very well, that one of the things to watch out for is when the grief that you're experiencing interferes with your life, when you have trouble getting out of bed, when you can't sleep or you have no energy, you're feeling guilty and it's just overwhelming guilt that you can't do anything to shake and it's just sticky and going throughout your day. And you might even have thoughts of suicide or thoughts of wanting to be reunited in death with the person that you lost. And that's pretty common. And at the same time, those are warning signs that it's time to speak to a healthcare professional. When that grief for weeks and weeks starts to interfere with your life and you can't go to work, you can't go to school, and you can't do the things that you did before because it's overwhelming.
And doctor, I was reading here that there are 5 to 7 stages of grief. Obviously, every individual is different. Do we need to go through those stages to, I guess, overcome and move on?
Right. So there's been many, many years of research on stages of grief, speaking to people who've grieved. But I would say that, again, grief is so individual. There are general things that we know about grief, but I wouldn't say that it's the case that you need to go through all of the Elizabeth Kubler-Ross stages of grief, the researcher who coined some of these stages, in order to grieve successfully or to grieve in a way that it doesn't impact your life any longer, that you've come to terms with the loss and made sense of it.
Do you have any, and I know we could go on forever and we have so many questions, but do you have tips to help someone with the grieving process? Sometimes I think walking and exploring nature is helpful, listening to music. What are your thoughts?
Right, those are good distraction techniques. One of the things that we know now about the pandemic is that some of the rituals that we have around losses have been disrupted. There aren't wakes or funerals or other kinds of spiritual services anymore because it's just not safe. There's been public health restrictions. And one of the pieces of advice that I give to my patients, and I would encourage your listeners to think about, are the ways in which you personally want to remember the people that you've lost. Is it lighting a candle? Is it writing a letter to them personally? Is it having your own individual memorial service or saying a prayer to them in your mind? How do you want to mourn them separate from what's possible or what's not possible right now with a group? Making your own rituals and to connect the person that you've lost, to acknowledge their life and to make sense of the loss to the extent that you can.
I do want to talk about something in terms of more than just grief, but the result of the COVID-19 pandemic. They're saying that there could be a mental health pandemic in the near future. Let's watch this short video and we'll talk about it right after, doctor.
The number of COVID cases in the U.S. continues to trend down, and more states are rolling back virus-related restrictions. But experts warn about a coming mental health pandemic. They say establishing boundaries about what is acceptable in your life can help.
So many people come to therapy feeling powerless. And, you know, a part of my job is to empower them to create the sort of life that they want. And that starts by having some boundaries and communicating those things. I've seen when people start to use their voices a bit more, that some of that anxiety and depression, it certainly decreases.
Getting some physical activity and taking time for meditation can also help to soothe the spirit.
Just some thoughts, doctor. Is there already a mental health crisis? We've obviously been through more stress than we ever imagined would ever occur to us in the past year and a half.
So certainly there is some evidence that we're seeing increased rates of depression and anxiety. There was a recent survey done by the American Psychological Association of adults in the United States, and it found that the vast majority, I think over 60%, the results showed, experienced an increase in their anxiety levels during the pandemic when they were asked. And for some folks, that brings them into care, it brings them to see a mental health professional. And I know even anecdotally that many folks are going to see mental health professionals right now, and there might even be wait lists to see mental health professionals in some areas because of the increased utilization of people seeking out care that they certainly need. But certainly more research needs to be done, more work needs to be done on examining these trends in people's mental health.
I want to let our viewers know, please, if you have a question for our expert, all you have to do is give us a call, send in your question. The phone number, you see it right there, 855-796-4475. And you can email us questions@allhealthtv.com. We certainly would love to hear from you. And doctor, I just got a question in that I want to read to you. And there is no name, but the viewer does ask this. There's a lot of grief that involves loved ones who are very, very sick, but they haven't passed. Their lives will never be the same. How do family members cope with that? Your thoughts?
We know that from the research, this is called anticipatory grief. So you're anticipating a loss that is going to happen. It could happen in minutes, it could happen in days, or even months, someone who's ill and maybe in an ICU. And what I would encourage is to find ways of connecting to that person while they're alive. Think about ways that your time with them is meaningful. Even though you can't do the same things with them before, you can make memories. Maybe you could share laughs if the person is awake and oriented, but you can sit with them, even have a conversation, even if they can't talk back, to create those memories and meaningful moments in that time that might help you with that anticipatory grief.
And doctor, refresh my memory, because I've heard along the way when number one, I studied, and number two, you hear about the anger stage, the denial. What are those stages that one has to go through, which are normal stages, if you will, to once again be able to mourn and then again move on?
Right. I would say from my own work, certainly there's anger and denial. And, speaking Kubler-Ross stages aside, one of the things that I would definitely say is important is understanding the loss in the broader context of your life, that these losses happened and these people are meaningful to you, and that they will live on in your memory and you can connect with them always. And that this loss should not define you moving forward as a person. It should be one thing that happened to you, but it should not define you as a human being.